We've talked often about how younger people have been pretty immune from the effects of this disease, although we know there are school children, teenage school children infected in New South Wales at the moment. But the big fears are about the elderly, and the victims we have seen tragically die in Australia have been elderly people this year. And we're joined now by Patricia Sparrow. She's in Melbourne as well with the Aged and Community Services Australia organisation. Thanks for joining us, Patricia. Obviously, been a big focus on prevention in the aged care sector. Now, there's all sorts of controversy about the aged care sector already because of the Royal Commission, complaints about standards of care. What have you been able to do to beef up procedures, knowing that this virus is on our shores and will continue to spread?
So aged care providers, every year when there is flu outbreaks or gastro outbreaks, they prepare. They're well versed in making sure that they are rolling out infection control and disease control guidelines. They have already started to do that. They all have emergency plans which they are now implementing. Obviously this is a little bit different, and we are taking advice, and providers are taking advice from the health authorities as the situation is evolving.
We've had the nursing home infection not far from here in northeast Sydney, where there was a patient passed away, an infected worker at the hospital, at the aged care home. We had staff staying away as a result of that. How can you ensure not only that practices are up to standard, but that people give the utmost priority, I suppose, to the care of the people in the aged care homes?
And look, firstly, our condolences to the families and loved ones of the resident who's passed away. Also to the residents and the staff who are still being monitored. We're wishing them a speedy recovery. Providers are very focused on making sure that they are able to protect both their residents and their staff. We're working hard with staff. It's natural that staff are going to feel nervous. I think we're seeing that in the general community, and staff are no different. We're trying to make sure, and providers are making sure, that staff are informed and equipped to be able to deal with and provide care to the residents in a way that's safe for them, and focused very much on the residents as well, and making sure that we're looking after them as best as we can. We are asking people who are unwell not to come to work, and obviously screening people. We're asking family members and loved ones, if they're unwell, not to come and visit. There are many ways in this day and age that we can stay connected, including through telephones and FaceTime. So we're asking people as much as possible to assist. We're doing everything we can do as providers to make sure we're rolling those plans out, rolling out our infection control guidelines, and making sure that we're ready, we're screening, and we're asking the community in general to assist us to protect our residents and keep them safe.
Are there mixed messages in the way we're reacting here? Are we overreacting in some cases? We get an infection at a school, the school closes down. Of course, when there's an infection in an aged care home, we expect people to still turn up and care for people, taking the adequate precautions. How do we get that balance right?
Yeah, it's a difficult balance. I'm not a medical expert, and this is where we are taking advice from the health authorities. What the government has committed to do is to ensuring that aged care and aged care workers have the protective equipment that they need. We saw the 54 million masks, etc. yesterday, so we're working very closely with state and commonwealth governments to make sure that providers are equipped and that staff are informed and confident that they can continue to perform their role.
Do you know if any other aged care homes have had problem with staff? Are staffing issues arising yet?
I'm unaware of any specific staffing issues other than what we've seen at Baptist Care. I think it's really important that what we do and what we're doing as a peak body, and what our members are trying to do, is to make sure that staff have the information and that we're looking at what are the sort of contingency plans and things we need to do if we need to call in additional staff. That's not where we are right now. And I'm unaware of any other specific incidences.
What about ancillary services, food deliveries, laundry suppliers and all those sorts of things? Are you working competently with them? Have there been any disruptions to supplies there?
I'm unaware of disruptions, but what we are doing in aged care homes is the screening is coming into place, so providers are screening, and this is where it's really important, that message I was giving before about staying away if you're unwell, but providers are and homes are screening people and talking to them before allowing entry.
So, I mean, the advice to people who want to go visit their loved ones in aged care facilities, obviously, if you think you just got a bit of a, even if you just think it's a bit of a cold or whatever, stay away, obviously. But otherwise, if you're visiting, just be super diligent when it comes to hand sanitation and coughing.
It's absolutely the same as for the general population. For aged care workers and for visitors, is to follow all of those good hand washing, etc. All of those things that we're being told to do. And as I said, for our staff, it's making sure they've got the information and the personal protective equipment to deliver care safely.